Electrocardiography or ECG. Electrocardiography is the process of producing an electrocardiogram, ECG or EKG. It is an electrocardiogram of the heart, which is a graph of voltage versus time of the electrical activity of the heart using electrodes placed on the skin. These electrodes detect the small electrical changes that are a consequence of cardiac muscles depolarization followed by a repolarization during each cardiac cycle. Changes in the normal ECG pattern occurs in numerous cardiac abnormalities, including cardiac rhythm disturbance. ECG is the electrical recording of the heart. These are the waveforms: P wave, QRS complex, and T wave. And the intervals are PR interval, PR segment, QRS complex, ST segment, QT interval. These are the segments and the intervals of the ECG waveforms. P wave is the first positive wave, and Q and S wave are the negative waves. R wave and T wave are the positive waves. There are three main components to an ECG. The P wave is the first waveform in the heart. The P wave, which represents the repolarization of the atria. The QRS complex, which represents the depolarization of the ventricles. And last, T wave, which represents the repolarization of the ventricles. This is cardiac cycle, where start with the P wave, atrial depolarization and atrial contract, PQ wave, R wave, PQRS wave, ST segment, PQRS and PQRST wave formation, and finally the PQRS and T wave. These are the waveforms formation in cardiac cycle, the electrical events of the cardiac cycle. During each heartbeat, a healthy heart has an orderly progressing a depolarization that starts with the pacemaker cells in the SCA node. SCA node is otherwise called as a pacemaker of the heart or natural pacemaker, which spreads throughout the atrium and passes through the atrioventricular node down into the bundle of his and into the Purkinje fibers, spreading down and to the left throughout the ventricles. ECG can be used to measure the rate and rhythm of the heartbeats. The size and position of the heart chambers, the presence of any damage to the heart muscle cells or conduction system, the effects of the heart drugs, and the function of the implanted pacemaker. These are the conduction system pathways, where SCA node, AV node, bundle of his, right and bundle branches, and Purkinje fibers. These are the overall conduction system of the heart, where these impulses spread to the heart and heart begin contract and pump the blood to the overall parts of the body. This is the diagram which shows conduction system of the heart: SCA node or sinoatrial node and AV. There are four chambers. The SCA node located in the right atrium, and the impulses pass to the AV node. AV node is otherwise called as atrioventricular node, and bundle of his, the impulses spread to the SCA node to the AV node, and AV node to the bundle of his, and bundle of his to the bundle of his is divided into two branches: right bundle branches which transmit impulses to the right side of the body, the left bundle branches which transmit impulses to the left side of the body, and finally Purkinje fibers. The electrical impulses spread from SCA node throughout the left and right atrium, causing the atria to contract and expelling its volume of blood into the ventricles. Electrical impulses spread from the bundle branches throughout the left and right ventricles, which causes the ventricles to contract, forcing them to expel their volume of blood out and into the general circulation. This is the overall conduction system of the heart. This is the wave formation of the ECG. The P wave, atrial activation, and QRS complex, ventricular activation, and heart, T wave, recovery wave. These are the overall waveforms present during the conduction system of the heart. One heartbeat consists of an atrial depolarization and atrial contraction, P wave, ventricular depolarization, ventricular contraction, QRS complex, and the resting phase including the repolarization during the T wave between the two heartbeats. In a conventional 12-lead ECG, 10 electrodes are placed on the patient's limbs and on the surface of the chest. The overall magnitude of the heart's electrical potential is then measured from 12 different angles, leads, and it's recorded over a period of time, usually 10 seconds. In this way, the overall magnitude and direction of the heart electrical depolarization is captured at each moment throughout the cardiac cycle. There are 12 leads which are used to measure the electrical activities of the heart. The 12 lead ECG electrode placements are to measure the heart's electrical activity accurately. Proper electrode placement is crucial for heart rhythm abnormalities. To diagnose the rhythm abnormalities and rate abnormalities or any other abnormalities of the heart, ECG is the best method to detect the heart rate abnormalities or rhythm or other abnormalities of the heart. To measure the heart's electrical activity, 3 bipolar limb leads and 3 unipolar augmented leads, 6 chest leads are placed on the patient's chest leads. Chest leads are otherwise called as pericardial leads or electrodes, and placements of the chest leads are V1, V2, V3, V4, V5 and V6. V1 is the V1 is placed in the fourth intercostal space at the right border of the sternum, and V2 is attached to the fourth intercostal space at the left border of the sternum. V3 midway between the placement of V2 and V4, and V4 is fifth intercostal space at the mid clavicular line, and V5 is the anterior axillary line on the same horizontal level as V4. V6 mid axillary line on the same horizontal level as V4. These are the 6 ECG leads placements in the chest. These are called the pericardial leads. This diagram shows the lead placement of the hearts V1, V2, V3, V4, V5 and finally V6. And vertical plane, frontal plane. By using 4 limb electrodes, you get 6 frontal leads that provide information about the heart's vertical plane. They are lead 1, lead 2 and lead 3. And augmented vector right AVR, augmented vector left AVL, augmented vector foot AVF. Lead 1, 2 and 3 require a negative and positive electrodes for monitoring. On the other hand, augmented leads AVR, AVL and AVF are unipolar, requires only a positive electrode for monitoring. These are the 12 leads placed on the patients. To limb leads. The limb leads electrode placements of the right atrium, left leg and right leg. These are the leads placement: lead 1, lead 2, lead 3, AVR, AVF and AVL. Weaves respected on 12 lead ECG. Lead weave of the heart. Standard limb leads, bipolar leads. Lead 1 lateral wall, lead 2 inferior wall and lead 3 inferior wall. Augmented limb leads are unipolar. AVR no specific weave, AVF lateral wall, AVL inferior wall. Pericardial and chest leads unipolar: V1 septal wall, V2 septal wall, V3 anterior wall, V4 anterior wall and V5 lateral wall, V6 lateral wall. The end-oval triangles explains why there are 6 frontal leads when there are just 4 limb electrodes. The principle behind end-oval triangle describes how electrodes right atrium, left atrium and left leg do not only record the electrical activity of the heart in relation to themselves through the AVR, AVL and AVF leads. They also corresponded with each other to form lead 1 right atrium to left atrium, lead 2 right atrium to left leg and lead 3 left leg to left atrium. They form an equilateral triangle, hence it is called an Einthoven's triangle. Einthoven's triangles are named as William Einthoven, who invented the first practical ECG. In that Einthoven's triangle, RL is neutral, also known as point 0, where the electrical current is measured. This diagram shows the Einthoven's triangle. Horizontal plane or transfer leads. By using 6 chest electrodes, you get 6 transverse leads that provide information about the heart's electrical plane. V1, V2, V3, V4, V5 and V6. Like the augmented leads, the transverse leads are unipolar and requires only positive electrodes. The negative pole of the heart leads is found at the center of the heart. This is calculated with the ECG. This is the normal waveforms present in the ECG. Lead 1, lead 2, lead 3, AVR, AVL, AVF, V12 and V6. Best mnemonics for ECG leads. Lead 1 lateral, lead 2 and lead AVF are inferior, AVR, AVL are lateral, V1, V2 are septal, V3 anterior, V4 anterior, V5 and V6 are lateral leads. This is the basics of ECG electrocardiogram. Thank you.